management and prevention of the PCOS. It is clear that this syndrome cannot be cured, but the symptoms can be lessened and managed to bring relief to the patient and to maintain the menstrual regularity and to avoid the menstrual irregularities and the disturbances created by this syndrome. The hallmark in treatment is that reduce the weight of the patient. Obesity is considered to be the main factor, that is the aggravating factor in this syndrome. So the speed and the ratio to reduce the weight of the patient is necessary and beneficial and brings rapid management in the symptoms of the patient. Take sufficient quantity of water, be hydrated, have a regular aerobic exercise, have healthy diet which is consisting of necessary vitamins, minerals, and also avoid the depression and the stress condition by the yoga exercises and adopting the healthy hobbies. So we can lessen the symptoms of this syndrome in the patient by adopting suitable preventive measures. As far as the medical treatment to lessen the symptoms, to bring the normality in the menstrual cycles, which is the basic, the duty in the female reproductive organs. There is oligo polydysmenorrhea complications which leads to anovulation and that leads to the female infertility. So this is the hazard or the miserable stage of the PCOS. If the patient is not desiring pregnancy, so the contraceptive pills, which consist of combination of progesterone and the estrogen hormone, they are started as a treatment in such patients. Moreover, we also adopt the medical treatment also. So medical treatment is only adopted if the patient is desiring the conception and the pregnancy. So in this condition, we treat the diabetes, hypertension diseases by the suitable amounts and dose of the drugs, and then we adopt the anti-androgenic drugs, that is clomiphene in the form of pills. So your health care provider can advise you the regime of the clomiphene to act as anti-androgenic drug. To increase the sensitivity of the tissue for the insulin, we also start the therapy of the metformin. So this drug increases the sensitivity of the tissue to obey the order of the insulin and take up the glucose inside the tissue for the production of the energy for the body. So these two medicines Chromifene act as anti-androgenic action, while the metformin is used as to increase the sensitivity of the tissues towards the insulin. So insulin reduced level is reduced and androgen production is reduced, so that can bring the relief to the patient due to the decreased level of the androgens in the blood. So these are the basic principles of the treatment in for PCOS. Now when the patient suffering from this syndrome needs or desire of pregnancy, there is an alternate modern scientific procedure, that is in vitro fertilization. In this process, the ovum and the sperm is fertilized outside the body of the patient in the lab, and when the fertilized egg is shifted into the uterus of the patient for the further development up to the birth of the baby. So there are various complications produced in this syndrome, that is there is premature or preterm delivery, then there is more chances of abortion, there are chances of obesity, overweight, then there are chances of endometrial hyperplasia in the uterus leading to the cancer. So this syndrome basically produces an ovulation, infertility in females, produces menstrual irregularities, and these can be managed, can be reduced, but this syndrome or the symptom collection of the symptoms cannot be rooted out or the cured completely.